Well, COVID-19 is a brand new strand of the coronavirus doctors have never dealt with before. So do we know the long-term effects this virus could have on a person's body? Joining me now to help answer some of our questions is forensic pathologist and Fox News contributor, Dr. Michael Baden. Dr. Baden, thank you for having us. Thank you, Arthur. Listen, I'm getting a little sleepy now. Please forgive me. Let me ask you this, sir. I want to start with this thing attacks the lungs. So my first question is scar tissue in the lungs potentially one of the long-term effects?
Yeah, you're right on target, Arthel. The deaths will occur largely because of the severe lung infection that coronavirus can cause. But remember, 99% of people, it looks like from the statistics and the deaths so far, are going to recover. Those who are going to die largely will die of lung infection, and we don't know how many people will have scarring of the lungs that will be present 5, 10, 15 years from now and cause some shortness of breath and illness then. We only have about less than a month of experience here.
Yeah, that's...
But Arthel,
yes,
the reason that the president has to use his war powers now to make the ventilators and the respiratory masks is to prevent the damage to the lungs that causes the death and causes scar tissue in survivors.
Well, the president says the reason he hasn't actually officially implemented the law is because he is saying that he's getting so much cooperation with people from the private sector to help build and produce the equipment that he needs. So what do you say to that?
Meanwhile, from what I'm hearing from around the country is that the hospitals aren't getting the ventilators, for one thing, and the masks. 3M can make, millions of masks in a very short period of time, which is much more than just donations by private people. So I think the private donations are great. We need more ventilators. The War Powers Act would permit industry that isn't functioning in some ways, a car industry, motor industry and all, to convert, to make ventilators immediately now, and that will cut down the number of deaths and will cut down the damage to the lungs that the coronavirus infection causes, even in those who survive, who recover very nicely at this time, but may find out that they have lung damage 10, 20 years from now that's causing interference with breathing.
Okay, so your clear message to the president is to implement the Defense Production Act. I want to go back to where we started, Dr. Baden, because I mentioned to you, it's like I'm getting sleepy, because I'm like most Americans right now. You're not sleeping well, you've got this low-level anxiety happening, or maybe it's really high stress for some people. If you could talk about the ways that stress affects the body, and maybe that could help us understand what's happening and how this part of this crisis could affect us.
Well, as we've seen, the emotional part of the coronavirus has overtaken a lot of the actual medical impairments. And I think that stress certainly is going to continue if we're going to have this massive infection rate. But everybody should remember that 99% of those who are infected, maybe more than that, are going to recover. They're going to recover. The vulnerable people, the older people, people in nursing homes, people in jails and prisons where they are confined, are running the risk of having severe infections, more deaths, and more long-term compromise than we have now. And I think that there's a balance now between the physical impairment that can be countered with the respirators and medical attention, and the treatment of the personnel who do the health care, who need the PPE, the equipment, so that they don't get sick. Because one of the problems, too, is that the overwork, the lack of equipment is causing the healthcare personnel to get sick and to drop out of what they should be doing.
Yeah, and Dr. Biden, we will leave it there because you're absolutely right, sir. Our concern, number one concern, is for those first responders, those critical care doctors, ER doctors, those who are dealing directly with the coronavirus patients. Dr. Michael Baden, always a pleasure. Thank you, and be safe. Take care.